If you're experiencing pain, swelling, and joint stiffness due to arthritis, gout, bursitis, or tendonitis, indomethacin could be the medication for you. This nonsteroidal anti-inflammatory drug, NSAID, works by blocking your body's production of certain natural substances that cause inflammation, helping to decrease swelling and pain. It can also be used to relieve pain from various other conditions. If you're dealing with a chronic condition like arthritis, make sure to talk to your doctor about other non-drug treatments or using other medications to treat your pain. As always, it's important to follow your doctor's advice on the daily dosage and the best time to take this medication. Before taking indomethacin, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually 2 to 3 times a day with a full glass of water. Do not lie down for at least 10 minutes after taking this drug. If you experience stomach upset, take it with food, milk, or an antacid. The dosage is based on your medical condition and response to treatment. In children, the dosage is also based on weight. To reduce your risk of stomach bleeding and other side effects, take this medication at the lowest effective dose for the shortest possible time. For ongoing conditions such as arthritis, continue taking this medication as directed. In certain conditions, it may take up to 4 weeks when this drug is taken regularly before you notice the full benefits. If you are taking this drug on an as-needed basis, remember that pain medications work best if they are used as the first signs of pain occur. If you wait until the pain has worsened, the medication may not work as well. Make sure to tell your doctor if your condition worsens. If you experience upset stomach, heartburn, headache, drowsiness, or dizziness while taking indomethacin, it's important to tell your doctor or pharmacist promptly. This medication may also raise your blood pressure, so be sure to check it regularly and inform your doctor if the results are high. It's important to seek medical help right away if you experience any serious side effects, such as hearing changes, mental/mood changes, difficulty swallowing, symptoms of heart failure, signs of kidney problems, unexplained stiff neck, or symptoms of liver damage. While a serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction. Remember, this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects that are not listed here. Indomethacin, like other nonsteroidal anti-inflammatory drugs, may rarely increase the risk for a heart attack or stroke, especially if taken for a long time. The risk may be higher in older adults or those with heart disease, high blood pressure, or diabetes. It's important to avoid taking this drug right before or after heart bypass surgery. This medication may also rarely cause serious bleeding from the stomach or intestines, especially in older adults. It's important to be aware of the symptoms, such as abdominal pain that doesn't go away, bloody or black stools, and vomiting that looks like coffee grounds. If you experience any of these serious side effects, such as chest pain, shortness of breath, sudden vision changes, or weakness on one side of the body, it's important to seek medical help immediately. Before starting this medication, be sure to discuss the risks and benefits with your doctor or pharmacist. And remember, always take the medication as prescribed and at the recommended time. Before taking indomethacin, it's important to let your doctor know if you have any allergies to medications, especially to aspirin or other NSAIDs. Also, inform your doctor about your medical history, including asthma, heart disease, high blood pressure, liver disease, and any kidney problems. It's crucial to stay hydrated while taking indomethacin, especially if you are older, have heart failure or kidney disease, or are taking certain medications. This is to prevent kidney problems that can occur with the use of this medication. Be cautious when consuming alcohol or using marijuana while taking indomethacin, as it can increase the risk of dizziness and drowsiness. If you're a regular alcohol consumer or smoker, it's important to limit alcohol intake and stop smoking to reduce the risk of stomach bleeding. Before undergoing any surgery, be sure to disclose all the medications you are taking to your doctor. Also, be mindful of sun exposure while taking indomethacin, as it can make your skin more sensitive to sunlight. For older adults and children, there may be an increased risk of certain side effects, so it's important to discuss the risks and benefits with your doctor. Additionally, women of childbearing age should talk to their doctor about the potential risks of using indomethacin during pregnancy or while breastfeeding. When taking indomethacin, it's important to be aware of potential drug interactions. This medication may interact with other drugs, increasing the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with indomethacin include aliskiren, ACE inhibitors, angiotensin II receptor blockers, corticosteroids, lithium, methotrexate, and certain water pills, diuretics. It's important to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers that may interact with indomethacin. This medication may also increase the risk of bleeding when taken with other drugs that also may cause bleeding, such as antiplatelet drugs and blood thinners. It's important to discuss with your doctor or pharmacist if you are taking any of these medications. Additionally, indomethacin may interfere with certain lab tests, possibly causing false test results. Make sure lab personnel and all your doctors are aware that you are using this drug. If you suspect an overdose of indomethacin and notice serious symptoms such as passing out or trouble breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call the local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include severe stomach pain, vomit that looks like coffee grounds, extreme drowsiness, slow or shallow breathing, confusion, and seizures. It's important to seek medical help if you suspect an overdose. Make sure you do not share this medication with anyone else. Your doctor may conduct lab and/or medical tests, like blood pressure, complete blood count, and liver/kidney function tests, while you are taking this medication. It's important to attend all medical and lab appointments. Talk to your doctor for more information. In addition to taking this medication, your doctor may recommend non-drug treatments for arthritis, such as weight loss if needed, and strengthening and conditioning exercises, to help improve your flexibility, range of motion, and joint function. Make sure to consult your doctor for specific instructions. If you are prescribed indomethacin on a regular schedule and you miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Take your next dose at the regular time. Do not double the dose to catch up. It's important to store indomethacin at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When it comes to disposing of the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.